cover just a few housekeeping tips. I'm happy to share that today we have translation that's generously been made available by UNESCO. Please note that this webinar is being recorded. We are also live streaming this event on YouTube, so we hope to have a maximum amount of participation. Just a couple of other things I wanted to share. Due to the format of Zoom, we're not able to activate the videos or audio for any of our participants. Thus, we'll only be using the chat function to take your comments and questions. We've also disabled the Q&A so that we can consolidate all of your feedback into the chat session. We'll also be monitoring the comments under the YouTube video streaming. So with that, it's my pleasure to introduce the Associate Director of Education for UNICEF, Mr. Rob Jenkins, who's going to give us a warm welcome and provide some opening remarks and context for this webinar series. Over to you, Rob.
Thank you very much, Lisa, and warm welcome to everyone. Good morning, good afternoon, good evening, depending on where you're coming in from. And thanks for making the time out of, I know everyone's incredibly busy schedules over these challenging days to participate and contribute to this important discussion. This webinar is a series of webinars that have been an opportunity for many different education stakeholders from around the world to participate in various dimensions of how the education community is responding to this pandemic. All with, I know we're all very much committed, and all with the perspective of how do we work together collectively for what's in the best interest of every child to enable them to continue to learn, and now moving to the reopening process. There have been many different dimensions and elements of the reopening process, and this webinar is a very important element to that. It's important for us to take a step back and always keep in mind the framework for reopening schools. I'm sure many, if not everyone online, have seen the framework. It provides a tool for decision makers as they decide how to safely reopen schools and how to manage that reopening process. We've had already two sessions on different elements of the framework, on learning and also on safe operations, and now we move to this important discussion. The framework is being referred to and does seem to be a basis of engagement in many different countries across the world, and we are learning more and more as that process is continuing on what are best practices, what are lessons learned, and how do we collectively move forward. Today's session is indeed on a very important topic, and that is how, within the framework of reopening schools and considering when and how to reopen, how do we ensure that students' well-being and protection remain paramount, and how do we leverage this process to provide the much-needed support that particularly the most vulnerable children in each context can be sufficiently protected and can be sufficiently supported. We have a very impressive group of experts, which you'll soon now hear from. Thank you very much to the panelists for participating. We are looking forward to a lively discussion. And as Lisa mentioned, we encourage you to use the chat room, contribute, comment, provide your own thoughts, and also, of course, we welcome questions. We can't solve all issues related to this very important topic in this next few minutes that we have together. So we also very much look forward to continue the engagement. Thanks again to everyone. I'm looking forward to this discussion. Lisa, let me pass back over to you.
Thank you so much, Rob. As Rob said, we are very fortunate to have an excellent panel with us today, and it's my pleasure to introduce them. So the first up is we'll have Dr. Ashley Namiro. She's the Mental Health and Psychosocial Advisor for Save the Children, and is also today representing the Mental Health and Psychosocial Collaborative. We'll then hear from Andres Feliz Sanchez, our Chief of Education in UNICEF Venezuela, who'll be giving us a deep dive on the programming there. Then we'll hear from Chris Castle, the Chief of Education and Health Sections of UNESCO, on the ways that school health and nutrition play a key role in learner health and well-being. We'll wrap up the presentations with Carmen Burbano from the World Food Program and a focus on school feeding and the importance of partnership. We'll then hand over to Rachel Cooper, also part of our global education team, to lead us in a moderated discussion. So with that, I will hand over to Ashley.
Thank you so much, Lisa. I'm just going to share my screen really quickly to get the slides up. Hold on 1 second. We tested it out and then now it's not seeming. There we go. Okay. Can you see, Lisa?
We do. Thank you so much.
Great. Okay. So thanks again, everyone, for being on this call. This is an extremely important topic, and I'm really excited to talk about networks of care and mental health and psychosocial support for children as we think about reopening schools. And as Lisa mentioned, I'm from the MHPSS Collaborative, and I'm presenting today on behalf of the Child and Family Subgroup, which is chaired by both UNICEF and the MHPSS Collaborative, which is part of the interagency MHPSS reference group. So, as many of you know, about 258 million children and youth are currently still out of school. And one thing that has become really apparent during the COVID-19 pandemic is the importance of promoting, protecting, and responding to the mental health and well-being of children, both through learning, through play, through various activities and intervention. So we always knew that it was of utmost importance to center any response around well-being. But a lot of momentum has been gained during this response. The pandemic that is currently happening not only can have a negative effect on our health, but also has the potential to have negative mental health consequences, not just for children, caregivers, but also community members. I will quickly quote a study that was done by Save the Children that reports that almost 1 in 4 children living under the COVID-19 lockdowns, social restrictions, and school closures are dealing with feelings of anxiety, with many at risk of lasting psychological distress. And of equal importance is the mental health and well-being of caregivers and all the adults that surround the child. We've seen an increase in education responses during COVID that include MHPSS considerations, social emotional learning activities integrated into remote learning activities, and the importance of emotional support being provided by all frontline workers. And I'll speak about the importance of keeping this momentum going as we think about reopening schools. But I'm first going to talk about what can continue to be done to support the eventual reopening of schools. So, while schools remain closed, teachers and caregivers serve an extremely important role in ensuring well-being, protection, and learning. So teachers can actually continue to connect with students through outreach calls, for example. They can call students, families, discuss at-home learning, also connect them to key services, and connect their caregivers to key services. So as you see here on the left, and I can share this document that was put together by the MHPSS Collaborative and Save the Children with review from Child and Family Subgroup members. And it talks about how teachers can connect with students to really ensure that when schools do reopen, that there's more of an ease in returning back to school by keeping that teacher-student relationship. I recognize that this is not always possible because it does require that people have access to a phone, but definitely something that, as I said, can keep that connection going. It's also important for caregivers to remember that they were their child's first teacher, and that they can continue to serve in this role, even if they're not a teacher. So this is this document that's on the left that I can share as well, which reviews tips for parents and caregivers during COVID-19 school closures. And I'll review next that there's a section on how caregivers can support their children when schools do reopen. And lastly, we also know the harmful effects that caregiver stress has on the child, which even makes it more important that when we think about supporting the well-being and protection of the child, that we also think about the social ecological model that surrounds the child, caregivers, community members, teachers, anyone in the child's life. And one thing that has really come out of the COVID response that I've seen is a lot of advocacy pieces are really calling on governments and practitioners to prioritize the mental health and well-being of caregivers, and also the protection from abuse and violence. I'm sure everyone knows that there has definitely been a rise in violence towards children, and it's really something that parents and caregivers, community members can ensure that is extremely prioritized. So it's really important as well that schools and social services and authorities continue to monitor children during lockdown, continuing case management, remote approaches until society and schools reopen further. This, again, includes ensuring distance learning is accessible for all children, which contains messages not only on what they're learning in school, but on health, hygiene, and keeping safe. So I'm going to review quickly a back to school guidance note that was put together, as I said, by the MHPSS Collaborative, Save the Children, and reviewed by child and family subgroup members. So how can caregivers help children prepare for school reopening? So it's important to continue to reassure children that schools will open again. In a lot of countries, in a lot of areas, we don't know when that's going to happen, but it's important to remind children that in fact it will happen. And really, caregivers can support children by sharing information when and how this will happen. The more information, the better. Information is power. And it's important to remind caregivers that children may feel nervous or reluctant to return to school, especially if they've been learning at home for months. And again, we have no idea how long this is going to last for, so it's important that caregivers are having these conversations. Remind children that they will be able to play with their friends, see their teachers, and continue learning new things. And not only while the schools are closed, but also when schools open. It's important to reassure children about safety measures as well in place to keep students and teachers healthy. And remind children that they can help prevent germ spreading by washing their hands with soap and coughing or sneezing into their arm. And prepare children so that they can understand that schools may need to close again. And that's the real uncertainty that comes around this pandemic, is even if schools do open, we don't know if they're going to stay open. So it's important to remind children that if in fact they do, when they do open, that they could close again. And reassure them that if schools do close again, it's really about keeping communities safe. And reassure children that caregivers will continue to support their learning even after they've returned to school. So I know on the webinar last week, the back to school guidance that was written by the education cluster and CPAOR was discussed. And I just wanted to go through quickly, I can share this document as well, but there is an annex on ensuring the mental health and well-being of children when schools do open. And I'll just go through some of the quick recommendations that were put in that annex. So making sure that child-friendly information on mental health and psychosocial support is available. And we know even using that terminology can be quite confusing. So include material that's inclusive and accessible. Illustrations, making sure that it's in different language, and identify child-friendly communication channels to share MHPSS messaging. So ensure channels are chosen inclusively and are accessible. So support peer-to-peer dialogues about returning to school. Remember, it's a big shift, especially for a child who has been out of school for some time, to think about shifting back to school. So make sure that those discussions are had and that safe spaces are created to discuss any fears that children might have, problems, challenges, and really support peer-to-peer solution finding. And explore how children and young people can be agents of change with the reopening process. Lastly, participate in discussion-making processes during the reopen with appropriate support from adults as needed. And it's really important too to make sure that teachers are involved in these discussions as well. And the last thing that I want to talk about is, as I said in the beginning, there's been a lot of momentum gained. So I have seen in almost every education response that's COVID-19 focused that there's been a big emphasis on the mental health and well-being, social emotional learning. So how do we take this momentum and ensure that when children go back to school, that MHPSS and social emotional learning is continued to be integrated into education systems, which we know historically is not the case. So it's really important that now when we think about schools reopening, that we advocate to national governments to ensure that teachers' well-being is recognized and taken into consideration, that various different mental health and psychosocial support considerations are integrated into the school system, and that activities are done within the school system that support mental health and well-being. And I think it's also important to advocate to national governments really to ensure that anyone who is returning to school is not stigmatized, especially if they are survivors of COVID-19. And to ensure that the children who don't come back to school, that is monitored, that is known, and that every action is taken to ensure that we do get children back to school, because that is one of the biggest things that I've seen is the risk is that children who were in school are not going to return. So based on those recommendations that I just gave, really making sure that there's dialogue in the community, that caregivers are informed to ensure that everyone does go back to school and that schools can be seen as a safe and protected place. So lastly, when I talk about making sure that mental health and psychosocial support and social emotional learning is integrated into every education response, that can seem pretty high level. How do we do that? What are the activities? And so I will, in the chat function, I'm going to send around a few different guidance notes that I've discussed today. And I also really encourage everyone to look at the operational guidelines that was put out by UNICEF. And it really outlines tons of different activities for different age groups, for primary, secondary, for teachers, for caregivers. And this can really outline some of those key actions that should be taken. And yes, I look forward to answering any questions from you all, and I will pass back over to Lisa. Thank you so much, Lisa.
Thank you so much, Ashley, for that really comprehensive overview. I think we all have some real questions and concerns about how children are doing during this period, and your presentation really clarified the important role that each of us has to play, teachers, parents, and all the caring adults. So with our next presenter, we're going to go from the general to the specific, and we're going to get some really great examples of what these responses look like on the ground. UNICEF Venezuela has been a leader in their mental health and psychosocial support efforts, adopting a number of innovative approaches to ensure children's well-being. And so with that, I'm going to hand over to Andres. Andres, over to you.
Thank you, Lisa. Good morning, evening, afternoon to all of you. I'm going to share the screen that I have prepared. It is. Can you watch it now?
Not quite yet. Oh, it's coming up
There?
now. There it is. Thank you.
Perfect. Excellent. So today I wanted to talk to you about the strategy implemented by UNICEF Venezuela to respond to the COVID-19 crisis, especially in regards to well-being and protection-related issues. The strategy to respond to the crisis is based in two main principles: coordination and complementarity. In coordination, we work vertically with building on strategic and technical advice from UNICEF at the global and regional levels, and then with the national and local levels to contextualize and the response. Horizontally, we work with the Ministry of Education, the MPPE in Venezuela, with the education cluster, which has played a key role in the process of standardization of the different tools we are using, and also with civil society organizations. With our partners, we coordinate to modify the modalities of intervention that we're implementing before this crisis and adapt them to the COVID-19 context and the situation of confinement. Regarding complementarity among sections within UNICEF, we believe that education is the nexus or the glue to offer an integral response to children's needs. Working with our colleagues in water and sanitation, in communication for development, nutrition, and protection, we are always looking for ways to improve the synergy between the various components of the UNICEF strategy. Schools in Venezuela were closed on March 16. The government came up with a plan called Cada Familia Una Escuela, so each family a school, sorry, with the aim to ensure the continuity of education while offering protection and prevention measures to fight the pandemic. We, in collaboration with the cluster, supported the organization of seminars to advocate for different issues, including continuity of education and also well-being and protection both for children and teachers. Among these was one on mental health, psychosocial support, and socio-emotional learning. The Ministry of Education developed a series of plans, including this one that I'm showing you, on psychosocial, socio-emotional attitudes within the family in times of confinement. UNICEF is contributing to the implementation of this plan by offering technical support to the Ministry of Education. We have hired a team of specialists for the production of material. Specifically, we are producing 10 capsules for TV, radio, and social networks on positive behavior, emotional balance, family values, and difference and identity, etc. At the same time, the cluster and UNICEF are supporting a pilot training program for the Ministry of Education officials and CBO organizations on mental health, psychosocial support, and protection. This training is about to be launched one of these days. A sense of normalcy includes having routines. That's why we believe that distance education is key. Before the crisis, we were supporting some partners to implement actions contributing to quality education in a school. Now we have changed the modality of intervention to support distance education, supporting some implementing partners on the broadcasting of educational programs through radio, including capsules on psychosocial support and protection. All these materials are aligned to the Cada Familia Una Escuela initiative. This also includes the use of communications like WhatsApp and social media for interaction between teacher and family. Finally, we are working with the Ministry of Education to develop a strategy for the safe reopening of schools following standards and advice facilitated by UNICEF, UNESCO, and the World Bank. This is an example of the material we have contributed to develop. It explains that the quarantine is a prior opportunity to strengthen mutual relationships within the family and talks about behaviors to create a good environment of respect. So what do we do in reality? I mean, what are our actions? One of them, a key one for us, is school feeding. For us, school feeding is a very high priority in Venezuela. Due to the impact of the economic situation, many children depend on school feeding for the daily food intake. Before the crisis, we supported a traditional school feeding program where food was being prepared and offered to children in schools. We had to change that implementation modality after the school closure. In some cases, daily meals are still cooked in schools, but now they are distributed by jefes de calle, what they call street chiefs, to every household beneficiary of the program. In areas where this is not possible due to the high incidence of the virus, we are distributing food bags composed of different elements like corn flour, beans, rice, vegetable oil, sugar, powdered milk, canned tuna, sardine, etc. UNICEF is also distributing hygiene kits at the household level with soap and printed material on COVID prevention and hygiene promotion. And we are also distributing education materials. We had stored a series of a big number of school in a box kits. And what we have done is that we have divided that into individual bags, and we distributed them to each child. Some implementing partners are also distributing what we call cuadernillos escolares, which are guidelines and activities for home. In the schools where the food is being cooked, we distribute as well hygiene kit for the processing mothers, so mothers that are helping us to cook the food in school. And in these kits, we include hand washing soap, antibacterial gel, masks, chlorine taps, dishwasher, liquid soap to prevent COVID spread. This is a video that we had some about the food distribution that we are undertaking in Venezuela. So let's go now to learning continuity from home. From a well-being perspective and protection perspective, we believe that providing a sense of normalcy is essential, and the continuity of education contributes to that. The individual follow-up by teachers from our implementing partners who visit the families and check on the homework made by children is essential. Parents deliver the homework in the school, and then they go and pick up the daily meals prepared in the school, and then teachers correct the homework and provide feedback to parents. There have been different alternatives to ensure that families get instructions on daily homework. There are, for example, panels outside the school, and there have been even publications in the national newspapers. This is an example of a publication that was released in a national newspaper, where parents or caregivers can read the daily tasks and take the guide home. We believe that the link school, community, family is key for us. With involvement of parents, caregivers, and the community in general, children have a much bigger chance to complete their studies and to fully benefit from the learning process. Teachers also need to have a sense of normalcy, and the continuation of training, even during this period, helps them to overcome the effects of the crisis. We are supporting distance training for teachers on different issues, such as self-care, psychological first aid, assertive communication, and resilience. We are working very hard to develop a program of incentives to support teachers. Although some of our implementing partners are already implementing small initiatives, we want to launch soon a program that will link teacher training and incentives. So teachers participating in a continuous learning program will get a grant or a subsidy in the form of a cash transfer. The protection section from UNICEF is including as well, is working as well with our implementing partners to provide information and advice on protection issues and is supporting referral systems. Here we have some figures of what we have achieved. As you can see, I mean, there are different, a lot of more than 150,000 children receiving learning kits. We want to make a bigger effort in distance teacher training and on the distribution of grants or incentives to teachers. We have already mentioned that school feeding is the other big priority for us, and we are already in contact with other big players to see how we can expand this type of activities. And of course, distance learning is seen as a great opportunity. So what are the emergent areas of practice that require more knowledge and action? For us, it's very important, the role of this distance learning. I mean, given the situation in Venezuela, distance education will continue to play a key role. We want to expand the infrastructure and the work of our partners on that. The crisis is forcing us to see this as an opportunity rather than as a challenge. Well-being and psycho-emotional support in the curriculum is also very important. This response has helped us to advocate for the inclusion of these aspects in the curriculum, and the Ministry of Education has understood the importance for parents, caregivers, and teachers, and we want to continue expanding on that. And then, as I mentioned before as well, the triad school, community, family is being key for the implementation of the distance learning, and we believe that this needs to be continued after the crisis. It contributes to get people involved in the learning process and to the sustainability of the efforts. And finally, inclusiveness is a very key aspect for UNICEF Venezuela. There are groups of people that are not able to fully benefit from these efforts. I'm talking specifically here, for example, of the indigenous community. We need to make sure that they are taken into account and that we develop tools and strategies adapted to their needs. This is all from my side from the moment. Thank you very much. And if you have any questions, I will be very happy to try and respond them during the Q&A part. Thank you.
Thank you so much, Andres. I'm sure there'll be a number of questions for you. We all know that there was a significant crisis in Venezuela before COVID arrived, and so it's really interesting and impressive to see how much UNICEF Venezuela has been able to do given all the constraints. Thank you so much for your presentation. Next, we're going to be moving to a presentation from Christopher Castle from UNESCO, who's going to be talking about the importance of listening to children's and young people's voices in the response. And speaking from UNICEF, we couldn't agree more. So over to you, Chris.
Great, thank you very much, Lisa, and hello to all participants. It's my great pleasure to join this important webinar, and I've really been struck by the consistency of the messages that have already been coming through from the two previous colleagues. My presentation will explore how school health and nutrition plays a key role in keeping learners safe and healthy in the context of COVID-19, and indeed during past and future infectious disease outbreaks. So I think we can also learn lessons and think beyond COVID in terms of the health and well-being of learners. So in the next slide, I think it's very important to listen to children and young people. All of us on the call know that. And responding to their needs and perspectives is as important now as ever. Young people are more than just beneficiaries of education, they're key actors and agents of change. Learning remains, of course, the top priority for education, and hashtag learning never stops has been a rallying cry to work as hard as possible to support the continuation of learning during school closures. Other webinars have explored this issue, including the urgent need to close the digital divide and other measures required to ensure access and support, as well as in low-tech or no-tech settings. So COVID-19 has reminded us that although the main mission and priority for education is learning, there are other important roles and benefits of schools, which we will consider in my presentation, many points of which have already come across. School health and nutrition has been around for decades. And many of you will be familiar with FRESH, which stands for Focusing Resources for Effective School Health, which was established in the year 2000, with many partners including UNESCO, UNICEF, World Food Program, and the World Bank, as well as civil society organizations and other development partners. We believe that the FRESH framework remains valid today and as an important reference to guide our collective work in school health and nutrition. Revisit what school health and nutrition is and why it matters. School health and nutrition is a multi-sectoral, integrated approach to promote the development, health, and well-being of students and the whole school community. It takes into account policies, including those that address equity, inclusion, and violence prevention, includes health and nutrition services, such as vaccinations and school meals, provides a health-promoting environment, offers a skills-based curriculum on health and nutrition, and works to engage learners, communities, and partners. So there's a lot going on in school health. On the right is the cover of a new advocacy brochure that was put out by several UN agencies, and you can see the logos on the brochure cover, calling for a renewed and collective commitment to advance effective and integrated school health and nutrition programs to ensure that children and young people are ready to learn and thrive and can contribute meaningfully to the future of their countries and communities. This set of partners are committed to mobilizing support and better align investments, bringing proven approaches to scale and responding to learners' needs holistically, ensuring children and adolescents have access to the comprehensive and child-centered programs they need and deserve. So in the next, a little bit more depth around what children and young people are telling us. And we have some important recent sources for this information that gets us this perspective in the COVID-19 era. The first I'll mention is a survey from the Children and Youth Council of Thailand, CYCT, and UNICEF, which was supported by UNDP and UNFPA, conducted at the end of March until mid-April, and with responses received from 6,771 young people, so a good response rate. Another source I will reference is the Youth Tech Health NGO that worked with UNESCO and which conducted focus group discussions with young people. Now, what emerges from these two sources of recent data reveals that young people how are they going to continue to learn and keep up or catch up with their learning, their mental health and sense of well-being. And again, that's the main focus of our webinar today. How will they be able to return to school safely? And we saw that consistently coming up. Maintaining their friendships and other relationships, and when we go back to school, and leaving no one behind and those particularly vulnerable. So in the next slide, you can see in this graph from the Children and Youth Council of Thailand survey that mental health and stress, as well as fearing about losing one's job or seeing one's financial resources diminish, are the main fears that young people expressed in that particular survey. They also indicated concerns around excessive internet use leading to inappropriate browsing, or access to health services and infection exposure concerns, and risks associated with unprotected sex and unwanted pregnancy during confinement. On the next slide, you'll see that in the Youth Tech Health focus group discussions with UNESCO, young people are concerned about maintaining their health and accessing services. And one young person told us, young people living with HIV are missing their antiretroviral doses. I don't have money to get my meds. How long will this last? We had another young person tell us, in fact, what many said, but this represented, I think, the views of a number, that teenagers are locked in their houses, and sometimes they don't have much entertainment except to explore their body. Finally, children often have practical insights and solutions, such as this 8-year-old girl in the DRC who told us, for our well-being, I can give this advice. Place buckets of water and soap in the classroom so that we can wash our hands regularly. She's 8 years old. Now, in the next graph, I think here I want to say that children and young people living in poverty, in refugee settings, and particularly girls, continue to bear a heightened burden of vulnerability due to COVID-19. We should also remember that LGBTQI young people are marginalized and vulnerable in many parts of the world, and COVID-19 has at times highlighted this. This data shows that young people who do not identify with either the male or female gender have expressed some distress by feeling lonely during lockdown, with reduced interaction with those close to them. Some have also felt increased stress caused by the necessity of staying at home. So in the next slide, I'm going to look a little bit at how we're responding. UNESCO has worked with sister UN agencies and other partners to focus on young people's needs in relation to violence and bullying, including school-related gender-based violence, sexual and reproductive health and rights, and comprehensive sexuality education through the Global Education COVID-19 Coalition and its 3 flagships, including one on gender. Now, some examples of what we've produced include the left-hand image, which is from an animated video for top tips in learning in lockdown. The middle image is an issue brief on health and well-being during home learning, and the image on the right side is a webinar organized all the way back in April that looked at learner health and well-being during school closure and reopening. I think probably all of us on this call are aware that there's been a lot of materials developed and made of videos, animated videos, and a number of other things, radio programs that would be relevant in lots of different contexts, and I think we should really welcome that. Many of these materials, by the way, can also be found on the UNESCO Clearinghouse for Health Education, which is hosted by our International Institute for Educational Planning. So go there for free open source materials in multiple languages, and you'll see a section with COVID-specific materials available. In the next slide, as part of the Safe to Learn initiative, UNESCO has worked with other partners on violence in school and other learning environments in the context of COVID-19. The first is a technical note that focuses on protecting children online. There's also been some technical guidance on how to provide a safe online learning experience, aiming to provide practical guidance for ministries of education. And then finally, recommendations that apply to all learning environments. Now, both previous talked about the importance not only of learners, but also teachers, and certainly at UNESCO, we would echo that. We recently launched new guidance that was developed around supporting teachers in back-to-school efforts. This was done by UNESCO Educational and Labor Organization. A quote from a primary school principal in Burkina Faso shares with us that, quote, "Before school reopened, the teachers were worried about resuming work and contracting the virus, as were the parents. We had no wash facilities, no masks, and large classes. Would have helped us a lot." I like this quote because I think it really underscores how important the multi-school health and nutrition really is. It isn't just the health sector or the Ministry of Health, and it's not just the education sector or the Ministry of Education. We have to work together. It's really, really critical, and I think COVID-19 has really shown us that. 3 of the key conclusions from this new resource on teachers and COVID-19. First, safety and well-being are the priority. And as schools reopen, school leaders can clearly communicate to teachers and staff that their health, safety, and well-being is the priority. Where possible, working together with school nurses and counselors is key to allay fears and establish plans and protocols. Promoting self-care and peer networks has also proven to be important. This is so teachers can recognize and manage their own stress and that of others and support each other. Teacher support networks via WhatsApp are having positive effects, for example, in the DRC and Uganda. And then upholding our places of work. And as such, certain measures are needed to support staff well-being, such as guaranteeing on-time salary payments and benefits. That's the last thing teachers need to worry about during confinement. Clarifying obligations and expectations, protecting teachers who are vulnerable or who have extra family burdens, especially female teachers. So in this last slide, as my conclusion, I just want to wrap up with a couple of key points. Partners are already working together to step up school health and nutrition. It's been around for a long time. And it's exciting at the moment to see how this is being revitalized and for some even rediscovered at the country, regional, and global levels. Let's increase efforts to ensure good health and nutrition to enable students to take full advantage of learning. We know that healthy learners learn better. And school health and nutrition can significantly improve learners' health and nutrition and their learning. So it's not one competing against the other, they go hand in hand. And then finally, school health and nutrition can play a key role in reversing the negative consequences of school closures in the context of COVID-19, especially for the most marginalized children and girls. Thank you very much.
Chris, thank you so much. It's kind of overwhelming to see the complexity and breadth of issues that young people are dealing with, and really an important reminder for us to consider all of those, particularly related to the health realm. So from there, we're going to move on to another dimension of well-being and protection, and I'm going to hand over to Carmen Bourbana, who's the director of the School Feeding Division at the World Food Program, who's going to be speaking with us more about nutrition and the importance of partnership. Over to you, Carmen.
Thank you so much. And first of all, I'd like to start by thanking the organizers and by thanking UNICEF for inviting us to be a part of this really important webinar, and to UNESCO and to the other partners, the World Bank, for the leadership that they are providing during the COVID crisis and the focus on protecting school children that have been massively impacted during this crisis. I'm very, very glad to see so many people from so many parts of the world connecting to this webinar. I was checking as my colleagues were speaking who was connected in the chat function of the webinar, and I just want to say that it's very it's great to see so many people dialing into such an important topic. And a specific shout out to my fellow compatriots in Ecuador. I know that there are some people connected there. I'm Ecuadorian, I'm from Quito, so hello to all of my country people. The World Food Program has been collaborating with many of the partners that have been presenting today, especially with UNESCO, with UNICEF and others, on this issue of the well-being of children in school. And as the speakers that came before me, I am very encouraged by the consistency and the messaging of this webinar, that we really need to focus, we need to see how we support the health, the nutrition, the well-being, the safety of children while they're in school, but also during this crisis, while they're at home and during that transition from home to back to school later on this year. And I would say this focus and the repeated recognition by the presenters that this topic is so important is not a mere coincidence, I would say. The COVID pandemic has highlighted the health factors that we are, of course, all vulnerable to, but the connection between well-being, health, nutrition, and our ability to be productive and healthy adults has become very stark for all of us during this crisis. And of course, the impact that this has had on school children and their ability to really learn and thrive has become even clearer as the pandemic and the mitigation measures have rolled out during the crisis. And the other reason why I think that the question of the well-being of children, how healthy are they, how well are they, their bodies, is also something that we had already been discussing for a couple of years with many of the partners, because of a World Bank report that was a World Bank report that was can you go back? Okay, not yet. It was published in 2018. It's called Disease Control Priorities, that highlighted very, very clearly that we as a world were neglecting the health and nutrition of children in schools. There were quite clear calculations of the amount of resources that were being put into the learning part of a child experience during their school age, including, for example, very important investments into teacher training, curriculum reform, infrastructure improvements, etc. So everything that goes into the learning and the teaching and the infrastructure to make sure that children are making sure that they're taking advantage of their education. But we weren't focusing enough on the learner. We weren't focusing enough on their actual well-being, on their health and their nutrition. The amount of resources that were being invested in this area were very, very inadequate and continue to be inadequate. So I think the COVID crisis has highlighted the fact that we really need to pay attention to this. And I'm encouraged also by the interest in this topic globally now as the COVID pandemic has unfolded. I'm here to speak specifically about one area that was already mentioned by a previous presenter in Venezuela, the importance of school meals programs, school feeding programs, because as the crisis unfolded, one of the things that became very clear was that not only children were missing out on their education, it also became clear that by not having access to school, children were not having access to vital meals. In many cases, these meals were the only ones that they receive a day. And so WFP with different partners started to tally, what are we talking about? How many children were being affected during the COVID crisis? You have this map here, which was published and is being kept in WFP's website, of about 370 million children at the height of the COVID crisis that were missing out on school meals. And here, of course, you have the breakdown by region. Very importantly, children in Africa, in the Middle East, in low-income countries, really missing out on these very important meals in schools. Now, one of the reasons why governments, partners, donors, NGOs, and other parts of the development community started to really worry about this topic is because school meals programs are essential safety nets that not only support the education of children, they also support various other parts of their lives and their communities. So in the next slide, we see that school meals programs are really important to build the human capital of a country, the ability of children to become healthy and productive adults. And there are 4 major reasons why governments choose to implement these programs. Of course, the connection to education. These programs are an automatic draw for children. They increase enrollment, they increase attendance, and they have a specific benefits on girls. We've been talking a lot in this webinar about the impact of school feeding on health and nutrition, and, for example, prevention of anemia and other factors that really affect children's ability to keep a diverse diet and a healthy diet, especially preventing overweight and obesity issues that are also a problem in so many of our countries. And then there are 2 other factors that are very important: the connection to rural economies, to local agriculture, smallholder farmers that really depend on these programs for a market that also provides a reactivation to local economies that is so important. And finally, very, very stark reminder during this crisis of the social protection element that these programs represent. These are indirect transfers to poor families that without these meals really struggle to put food on the table. So there are 4 very important reasons and 4 sectors that need to really pay attention to these programs, not just the education sector. And for those of you listening in on this webinar from countries and specifically from ministries of education, one of the things that we have been trying to foster is a multi-sectoral approach to these programs, where the Ministry of Health, Ministries of Social Inclusion, and Ministries of Agriculture really have various returns on investments to these programs. Now, the converse is also, of course, possible. When these programs aren't there and when they are not functioning properly, as happened during the COVID crisis, and we've seen that very much, the next slide gives us a reminder of what happens when these programs aren't here. We know that marginalized children, vulnerable children, are especially at risk, and the longer they are out of school, the less likely they are to return. This is specifically a preoccupation with girls, with older children, where their families might have more incentives to keep them at home, to put them to work, to marry them off. And this is a very specific warning for us that even if the schools reopen in the next few months, we might not have all the children coming back to school if measures aren't taken. Of course, a deterioration of their health and nutrition status. This is something that we're already starting to see during the COVID pandemic, and we're very worried. And as I was mentioning, what we call negative coping strategies, when families are under stress, when they are facing shocks like the ones that are right now undergoing in many developing countries and developed countries, families resort to negative strategies like marrying children off, like putting them to work really early on, etc. And so there are really increased risks for children. One of the things that we have been advocating for as part of a back to school moment, and this, of course, this webinar is about how to reopen schools in a better way. One of the things that should be part of those packages of well-being to children in schools is a school meal. It should be there because it is the right incentive to bring children back to school. The effects of the programs on enrollment and attendance tell us that it is the right incentive for parents to send them back to school. Let me share with you some of the examples of what we're seeing in the field already, some of the countries, but also partners supporting governments that really want to have tools to better open the schools, considering these elements. WFP, UNICEF, UNESCO, and the World Bank, of course, issued this framework that we're talking about today. There is a guidance note that you can find, and we can provide you the links, produced by WFP, UNICEF, and FAO on specifically how to ensure the continuity of school meals programs during the COVID pandemic. You can also have access to that. And support specifically, and for those of you that are listening in from countries, please reach out to the UNICEF counterparts, please reach out to WFP counterparts at the country level. They are ready and willing to support you in thinking through some of the options to keep these school meals and school health programs ongoing. Let me see if in the next slide we have some country examples for you. We've seen the leadership of governments, ministries of education, really coming up in this pandemic. And here you have some of the examples of what's happening in Madagascar, for example. The government switched very quickly with the help of the World Food Program to what we call take-home rations, THR, take-home rations, to about 200,000 children, so that instead of not having these meals, children were getting these meals, but in their houses. In Syria, WFP and UNICEF are providing vouchers to children so that their families can buy the food and they can buy health and nutrition and hygiene elements in the schools. The same is true, for example, in Niger and Chad and in other areas of the world. Let me just finalize. I think we have a last slide. No, okay. Let me just finalize by saying that early on in the pandemic, UNICEF and WFP came together to announce that we were joining forces to support countries with renewed health and nutrition efforts and technical assistance, operational support to those countries that really wanted to scale up their programs during the crisis, but also during the reopening of schools. And so we are very, very happy to be able to collaborate with all of you during this webinar and can make those resources available, both at the country level, but also at the global levels. Thank you so much.
Carmen, thank you so much for that great presentation. I think the note on partnership is so important and really critical to shifting into our discussion period. We all have a role to play, and we need to join hands as much as possible to ensure that we're working together. So it's my pleasure to hand over to my colleague, Rachel Cooper, who will be leading us in a question and answer session. So again, we'll be directing questions to each of the panelists from the chat that we've been monitoring in the YouTube live stream. And then we'll open up general questions to any of the panelists that are interested in answering. So Rachel, I hand over to you.
Great, thanks Lisa, and thanks so much to all of the panelists for these really informative presentations. There have been a number of questions that have come in through the chat. So Ashley, we'll start with a couple of questions for you. So the first question is, how can MHPSS activities and education responses be adapted for different age and grade levels? And the second question for you, Ashley, is related to the need for children to catch up on learning and school days, that this may be limited or shortened. So how can we fit MHPSS activities into limited instructional hours? And over to you, Ashley.
Yeah, thank you so much. Really great questions, and I appreciate your interest. So that's something that we grapple with a lot, actually. So we know that teachers are extremely overwhelmed. We know that we have full curricula, and that education systems have been built by national governments. And so what we've seen work in various settings, for example, I'm thinking about Uganda, is that you work with, let's say, psychosocial officers or social workers to come in and do some of these activities during breaks that happen. They can also be done after school. So in a lot of the contexts where we work, we have split schedules. So you have morning shift with students and then an afternoon shift. And so you can have people come in and support the psychosocial activities during that break, either before children come to school or after. I recognize that this does take added resources, but there's definitely ways to work with volunteers in the community, work with caregivers to deliver these activities. And also beyond just activities, there's definitely ways, and some of the panelists spoke about this, but it's not only mental health and psychosocial support activities that we're talking about, but it's also creating safe learning environments for children. So a big thing that you can do with teachers is really provide them with training and supervision so that well-being is blended into any school curricula. And so it's not necessarily an activity or an intervention, but it's the way in which teachers are delivering information and receiving input from children within the school setting. And then the first question, sorry, what was the first question? I forgot it. I got so passionate about answering the second one.
No problem. So the first question was, how could MHPSS activities and education responses be adapted for different age and grade levels?
Yeah, absolutely. Really great question. I think there's a lot of evidence around any type of MHPSS intervention on its adaptability. So a lot of times what you want to do is ensure that the language that you're using in any activities is contextual, is appropriate, is understood by different age group, by different language speakers. And this is really a process that can be done with community members, with teachers, with caregivers, making sure that when we talk about, for example, well-being activities such as deep breathing or relaxation exercises, stress management, it's an activity that makes sense and is not something that you're just introducing out of the blue, but in fact is something that really can resonate with people. And what I've done in many contexts is what you do, and you go and have conversations with people, really understand what they do already in the community to take care of themselves, what they do already to as a de-stress activity, what are language that they can use to talk to children about stress and the effects it can have on your body. So that's a really important component. And as you'll see in the UNICEF activity operational guidelines that I mentioned on my presentation, there's so much out there, and it's really around taking the time to adapt it. And I think test it too. So it's not just around adapting it to the context, but making sure that it makes sense to children, to caregivers, and to teachers. And I think with that, it's really around time and investing that time. Thank you so much.
Great, thank you, Ashley. So now, Andres, we'll go over to you, and we have a couple of questions for you from the participants as well. So, Andres, the first question is, could you please say more about how you're monitoring children's participation in radio programs, as well as mental health activities? And as an add-on to that, how do you include children with disabilities? And then the second question is, how is well-being and psycho-emotional support included in the Venezuelan curriculum? So is it included in existing subjects, or is it included as a separate subject? And are there any PSS activities that are ready to use for teachers, which can be infused into the curriculum or daily teaching? So over to you, Andres. Andres, we're having a little bit of trouble hearing you. I don't know if your mic is completely on. So we still can't hear you. Why don't we move on to the next set of questions, and Andres will come back to you after the next panelist, and hopefully we'll be able to figure out your mic in the meantime. So Chris, we'll move over to you and then come back to Andres. So Chris, a couple of questions for you as well. School health has long been an area of underinvestment. How do you think COVID-19 will change prioritization of school health? And similarly to the questions posed related to MHPSS, how is health included in the curriculum, and what are some of the ways school health can be integrated into academic subjects? So Chris, over to you, please.
Great, thank you for those wonderful questions. I'm seeing a lot of opportunity, actually, or a silver lining, if you will, in terms of COVID-19, and how I think there's a much better appreciation now of perhaps the less visible role of schools beyond its core key priority of supporting learning. That continues to be the overall priority for education, but I think now with COVID, people are realizing a really large number of values and benefits that schools provide. I mean, they are a really essential resource for the community for a number of things. People have talked about, for example, how important it is for essential workers, health workers, and others to be able to know that they can send their children to school so that they can carry on doing the vital essential work that they do as health workers, for example. And there were some countries that actually made sure that schools remained open just for the children of those essential workers as part of the COVID context in those countries. We also know, and all of us, I think, as presenters have talked about the value and importance of schools as places that should be safe places for learning. And I really appreciated, for example, Ashley's comment about how it's really important for all of us to work towards making sure that learning environments are safe and supportive places to learn. That's why efforts like the Safe to Learn initiative and other initiatives to help make resources available to train and support teachers, but also young people themselves, to understand how harmful school violence and bullying and school-related gender-based violence can be for learners in terms of their health and well-being. And the good news is, we know from a lot of evidence that this is something we can absolutely address and prevent. A lot of people, I think, in the past have this idea that school violence and bullying was just almost like a rite of passage and there's not really very much we can do about it. But that's not true. And we know that teachers can play a key role, but so can young people themselves. And one of the things that I'm struck by, for example, is how important bystanders can be when they see violence happening or bullying happening in schools amongst their peers, that they can stand up and say, you know what, I'm not cool with that. I think this is a problem. You should stop doing that. And I think when there's a collective social norm around not accepting, not tolerating school violence and bullying, then I think we'll see huge improvements in mental health and a sense of well-being for all learners in school. So I guess that's one thing I would like to say. And again, there's a lot of different things. Carmen and others talked about the value and importance of school meals as an important source of nutrition for young people in so many countries that were affected around the world by COVID and school closures. And I think we need to be more vocal about saying that we know that when a young person is hungry, obviously it's going to be hard for them to learn, even when schools are open. And we've seen some really wonderful examples of creative ways to try and support the nutritional support to schools are closed. But obviously school meals in particular are really important, and that beyond school meals, it's also education about nutrition, education about health and well-being. That's also very important when schools are in session or through distance learning actions. And so the second question that I had was about health in the curriculum, and I completely agree. I mean, we see a wide variety of ways in which different countries approach health and nutrition in the curricula as a cross-cutting way, whether it's examinable or not. And even in some countries, it might be the Ministry of Health that takes the lead on school health and nutrition, or it might be the Ministry of Education. Frankly, what matters is that young people get that type of health education as part of a good, holistic, child-centered school health and nutrition program. So one way or another, we need to make sure that it is being included as part of the curriculum, examinable or not, that teachers are trained and feel comfortable teaching about school health and nutrition. And again, school health is a really broad area, and it can include a lot of different things. And so it's partly also context specific. In some countries, we may not have problems, for example, with worms. And so, deworming programs just wouldn't be relevant, whereas in other countries they would. And where worms are a problem, that should obviously be a priority to address. Other school health and nutrition programs, or topics rather, would be more universal, and that, for example, would include issues around relationships and sexuality education. And we know from data that all young people in every country in the world grow up with a concern about getting good, gender responsive, gender equitable information about sex and relationships through good programs on comprehensive sexuality education. And we have a long way to go before good quality CSE programs are in place for young people. But the good news there is that UNICEF, WHO, UNESCO, UNFPA, and UNAIDS have come together to revise the International Technical Guidance on Sexuality Education to make sure that we're providing a really good evidence-based guidance to ministries of education and health in countries, so they can make sure that they're doing the best they can to respond to that priority request that young people always have when we talk to them and listen to their voices. Thanks very much.
Great, thank you, Chris. So Andres, we'll try to go back to you again, and let me know if you'd like me to repeat either of the questions.
Thank you, Rachel. No, I think that I solved it. I'm sorry for that. There was a problem with the button, my mute. So the first question was about how we make sure, how we monitor participation on the distance learning activities we're implementing. But that's a very good question. I mean, the government and the partners we are working with, they're running TV and radio channels where we are broadcasting this type of initiatives, and they have the means and the tools to measure audience. But of course, the challenge is how you measure participation, not just audience. For that, we cannot reach everyone, but we are trying with our implementing partners to be able to, we have a team of people that work with them, and they assist them in going home to home and contact parents and check on the homework, bring them to the teachers, and then the teacher can correct them and bring them back. And of course, we use every opportunity that we have during the distribution of food, for example, distribution of hygiene kits, or the distribution of learning kits to collect that work made by the children and then give them to the teachers, and they can correct it and go back. And also, as I mentioned before, there have been a series of initiatives whereby we connect teachers with parents using WhatsApp, for example. And through there, we can check whether they are they're actually following the tools, the programs we're implementing. So it's a mixture of tools and of initiatives that are making us able to follow this. Of course, we cannot reach everywhere, and this is the challenge, to reach everyone. But this is how we are doing it. And then regarding on how we include psychosocial support in the curriculum, this is also a step-by-step process. We were doing that before with partners where we're implementing education in emergencies trainings to teachers in some the schools where we were working in. But of course, this crisis has provided us with the opportunity to scale that up. The government has realized that emotional support and protection, well-being are important aspects to take into account in the learning process because they contribute to quality of the process. And then with a series of trainings we are implementing now for ministry officials, we hope that we are going to be able to include that into not just the teacher training, but also in the curriculum in the next months. So for us, I mean, this crisis has been an opportunity as well as a challenge, of course, but we believe that it has opened the way to deal with some aspects that before they were not taken into account.
Fantastic. Thank you, Andres.
Thank you.
So now, Carmen, over to you, and we have a couple of questions for you as well. So responses require intersectoral action. How are these processes coordinated at the national and local levels in terms of health, feeding, education, etc.? Is it through the mayor, through the prime minister? So any insights you can provide on that would be great. And then the second question is, what are some effective strategies for advocating for financing for school feeding when we know that national budgets will be constrained? So Carmen, over to you.
So those are, I would say, two central questions. And as I was mentioning before, these programs specifically related to school health and nutrition, and when I spoke about very, very concretely on school meals, are extremely multi-sectoral. In general, the Ministry of Education in most countries is the home of these programs, and as such, the education sector is the lead sector, although that's not the case in all of the countries. In some, it's the Ministry of Social Inclusion or Social Welfare, and in others, it's the Ministry of Local Government. So we do see a variety of institutional arrangements, but what is common to pretty much all of the successful programs that we see globally is that there is some sort of multi-sectoral framework that is put together at the government level, at the central level, and then that cascades down to the local levels. At a minimum, as I was mentioning, 4 major sectors should be involved: education, health, social protection, and agriculture into this. We would call it a multi-sectoral working group or a steering group or a task force of some sort. Brazil, for example, is a very good example of this through the National School Feeding Program, which is part of the government Zero Hunger strategy. But we also see in many countries in Latin America, in many countries in Asia, in Africa, that multi-sectoral working groups have been established to make sure that the various ministries that really have a say in the program are represented in a clear coordination structure. It is really important that governments also hold partners accountable to supporting these very important investments that governments have made a priority. So when we're talking about a Ministry of Education that is really looking at how to expand these programs at the local level, it is important that partners and donors are brought to the table from the different sectors to see how these finances, how the funding can be pooled. Now, one thing that we are discovering as we move forward, also from lessons from Latin America and Asia, is the importance of having the Ministry of Planning and the Ministry of Finance at the table. And the reason why this is important, and it goes to the second question, is because funding of these programs should not be seen, as Chris was saying before, they shouldn't be seen as competition of resources from the education resources and taking away from that budget to feed the children. This shouldn't be an either-or question. It should be more of a national discussion about the well-being of children in schools being part of priorities of developing the human capital of a population. And very often, it's the ministers of planning, the ministers of finance that really can have the full picture of the fiscal space in a country and the ability to finance these programs from centralized pots of money. So we know from various countries that when school feeding programs, school meals programs are taken as a priority, as in the case of Nigeria, for example, and I know some in Nigeria are connected to this webinar, the Vice President's office is really the leader, the champion of this program nationally. When those conversations start to happen at that elevated level and we start to see these programs as really priority, not just for the education sector, but for development in general, is when we start to see more fiscal space, but also better coordination between the sectors and between the partners. This obviously needs to cascade down as we move closer to the children and to the schools. Of course, there needs to be multi-sectoral working groups at the local levels, both at the district or at the regional level. In many cases, we see local authorities really pulling in people from different sectors. For example, the programs need nutrition expertise to make sure that children are eating healthy. And so for the design of rations, to decide what gets purchased from what kind of smallholder farmer, you need a nutritionist on board to design the rations, but you need also somebody from the agriculture sector at the local level to say what is being produced locally and what kind of products can be put into the basket. And you also, of course, need the participation of the education sector, which is the home of this program at the longer stage, and monitoring and all of the administrative tasks. So this really is a multi-sectoral task, and the multi-sectoral frameworks need to cascade from the top all the way to the bottom. Let me just also highlight that there were several comments around the need to sustain financing for these programs. And when we're talking about low-income countries, this is a preoccupation of the World Food Programme. Before the crisis, we were already raising the alarm that around 73 million children were missing out on school meals, but were living in extreme poverty in low-income countries. So already we knew that we had unacceptable coverage levels and that many, many children were being left behind, children that were already marginalized, children living with disabilities, that were out of school, girls, etc. The crisis is going to exacerbate that, and we're going to see those numbers go up. We are worried about a shrinking capacity of governments to fund these programs, and also a shrinking capacity of donors to continue to support them. Now, I think one of the conclusions of the conversations over the last few weeks, and also during this webinar, is how important it is to really sustain the investments that existed prior to the crisis, at least, so that we can ensure that the most vulnerable children are not getting left behind. So if governments have decisions to make between now and the way forward in opening schools, what we at WFP would say is focus on the poorest of the poor, focus on the most vulnerable, focus on the most marginalized, and if you need to target your resources, target to those children that are hardest to reach first. Thank you.
Fantastic. Thank you, Carmen. And that last point on reaching the most marginalized and the most vulnerable ties in very nicely with our last question that I'd like to open up to all of the panelists to contribute to with brief responses. So that question is, how are children who are out of school prior to COVID being included, especially children with disabilities? And what kinds of modifications can be made to make services more accessible to children with disabilities? So I'd like to invite the other panelists to provide some responses to this question.
Hey, this is Ashley. I'll briefly touch on that. It's really important to look at what are some of the stigmas and beliefs around children living with disabilities entering school. For example, in South Sudan, it's not only the teachers and the education system where there's actually a lot of stigma and discrimination, but it's also the caregivers. The caregivers don't quite, one, they don't want to send their children to school because they know they'll be stigmatized and discriminated against. And also there is this understanding that if your child is living with a disability, you don't send them to school. So these beliefs are coming from all angles. And because of that, there needs to be a long-term investment in really ensuring that children living with disabilities can get into school and that they are not discriminated against, and actually school systems, education curricula throughout the world is supportive and accessible to them. And I think what's really difficult is this oftentimes requires extra resources, which we know that teachers don't have. But it's just a huge, there's so many consequences to these children not being in school. So really ensuring that it's invested in at every single level is extremely important. And then in terms of children who were previously out of school during the COVID-19, before the COVID-19 pandemic, you know, there's so many great initiatives to get children back into school. I think similarly, you have so many children who aren't in school because family financial difficulties, their parents stop sending them to school. It's not acceptable for them to continue going to school. They're being discriminated against. And so a lot of these deep-seated problems really need to be addressed, and it takes time. I think that's the most important thing to remember. And it's not just addressing the caregivers or the teachers or the education system. It needs to be a community-wide intervention.
Great, thank you so much, Ashley. And I think we have time for one other panelist to provide an intervention, and then we'll be providing some important information before we wrap up. So Andres, it looks like you'd like to speak, so over to you.
Yeah, very quickly. I mean, as I mentioned before, we are seeing this crisis as an opportunity. Before the crisis, we had separate programs for out-of-school children and for children in school. And what this crisis has allowed us is to basically not see this dichotomy of children in school or out of school. We are through the programs that are implementing the distance education programs, distance learning. We are reaching every child, no matter whether they were in school or out of school. So it is really an opportunity for us to identify these children that were not in school and start treating them in the same way as children that are already registered and they were going to school. How do we identify children with disabilities? Well, through our implementing partners, we
Andres, you're on mute.
Yeah, sorry. I was saying that in the out of school children initiative that we were implementing before the COVID crisis, disability was one of the criteria that we were using for identifying these vulnerability levels, and then they were being identified by the partners we were working with. So they are now part of the program. Of course, there is an effort that we'll have to continue making to make sure that all these children are included. And it's not just children with disabilities, as I mentioned before. I mean, inclusiveness is a key aspect for us. Because there are large parts of the population that are receiving less support than the rest. And I was talking specifically about indigenous population in many parts of Venezuela. So yes, disability, people from different backgrounds, it's a very important and key aspect for us to take into account in the future. But again, I mean, the main message is that distance education, distance learning allow us to think globally and not in terms of children in school or out of school.
Great, thank you, Andres. Now, Lisa, back over to you.
Well, this has just been an amazing conversation. We've had almost 400 people from all around the globe coming in with comments and questions. I wish we had more time to get some more of them, but I really want to give a special thanks to our expert panelists for their wonderful interventions and insights. I think we've all learned a lot. So I just wanted to touch on a few things. It's unfortunate that we weren't able to have more time to talk about reaching the most marginalized children and children with disabilities, but fortunately, we are going to have a dedicated session to this on June 24th at the same time. So if you access the UNESCO website, you'll be able to get all the information to register for that important conversation. I also want to emphasize that if you've heard something today that was helpful to you or useful to you, please share the links with your colleagues. The live stream video recording or the recording of the webinar, both will be available on the UNESCO website. We'll also have a summary article of the main points in the discussion from the Q&A, which could be an important resource to all of you. So thank you all for participating in this. And lastly, I just wanted to say that there is going to be a link for a survey in the chat box. I encourage you to look at the chat box because there's been a lot of interventions there. It's so wonderful to work with colleagues from all around the world who are sharing their own insights and resources and links to important guides that we can all use as references. So please look in the chat. There is a link there for a survey, and this will help us determine what types of topics you would like to hear more about going forward in the future. Lastly, this is an unprecedented crisis. If we're going to move forward and do the best we can for children and young people, we have to continue to engage in this kind of exchange. We need to keep sharing with one another and looking for opportunities to understand what's working. So we invite you to continue to engage with us in this webinar series. Thank you again to all our panelists and all the participants, and we hope that you'll join us for our next session on June 24th. Bye, everyone.
The recording has stopped.